Good morning, everybody. What I'm going to talk about this morning is is magnet, but it's not that stuff that you ask your friends when they go for their travel, a souvenir. It's not the souvenir that you stick on the fridge, nor is it the pace. It's not the stuff that you use to stop your pacemaker in an emergency. So when we talk about magnet, we're talking about a recognition for nursing excellence. This is coming from the American Nurses Credentialing Center in the American Nurses Association. And King Faisal Specialist Hospital in Riyadh is the second hospital in the Kingdom of Saudi Arabia to be recognized after King Faisal Specialist Hospital in Jeddah. And we are third after the American University of Beirut in Lebanon, who received the first recognition in the Middle East. Before I go ahead with the presentation, I just want to make sure that, and I want to make it clear that I am not from the American Nurses Credentialing Center in the States, nor am I here to promote Magnet. I'm here to share with you the experience in the King Faisal Cardiac Surgery ICU during our journey to excellence, and surely I will tell you that getting the recognition and designation for Magnet is well worth it. So when we say Magnet starts with me, I'm talking about Magnet coming from the bedside nurses. Magnet starts with me because I am a nurse. I know what's going on at the bedside, and I know I can make the changes. Magnet, as we know, attracts, and by attracting, it means a Magnet designated organization. Nurses come and work for those organizations because they listen to nurses. So we are trying to empower nurses to deliver better care. And if the organization has a good reputation, patients will want to come to that organization to get their treatment. Excellent nurses deliver excellent patient care, attracting them to come to stay in the organization. We developed the theme, Magnet starts with me being as a staff nurse. Magnet is equal to excellence. Well, how does that really work? If you have excellent nurses, and when I say excellent, it means competent, well-trained, well-supported, and dedicated nurses to providing best patient care, then that would mean patients are getting the excellent and the best patient care they so well deserve. And probably you're wondering, I keep repeating the word excellence, because at the end of this presentation, that's what I wanted you to take home with you, that Magnet is all about excellence. The patient, that when they receive the care that we give them, what happens with the outcomes? We have better outcomes. We have improved outcomes. At the end of the day, when a patient gets discharged or transferred, how are they? They go home after a month, after getting a third-degree pressure ulcer, or after the patient had surgery. How was their experience? Did they get their pain medications on time? A nurse coming on shift who knows her responsibilities and performs as the advocate for the patient will definitely have a good feedback coming from a satisfied patient. In order for Magnet to work, these are the core principles or Magnet components. This is from the American Nurses Credentialing Center. So we have 5 components: transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovations, and improvements. And having these Magnet components alone will not work if the hospital doesn't have the following. This is in King Faisal. We have a mission to provide the best possible care to the patients. Our vision is to become a world-leading hospital. And with this, we are guided by the values of patient-focused, integrity, teamwork, quality, and compassion. We also have 5 strategic priorities in the hospital. We want to develop world-leading healthcare and research. We want to increase capacity and patient flow. We want to improve efficiency and decision-making. We want to enhance staff recruitment and retention. And we want to promote external relations and funding. We also have what we call the professional practice model. That's the one to your left, in the professional practice model, this one was developed by 100 nurses to come up with this. This is taking into consideration the values of the hospital, the culture in Saudi Arabia. So when we talk about the professional practice model, we're talking about our guide to nursing practice. It articulates what professional nursing practice is all about. The one to your right is the nursing care delivery system, which is the process of the nursing care given to patients. This, as nurses, we become responsible and accountable for the totality of the nursing care that we give to our patients. And this one to your right is the professional shared governance or shared decision-making model that we have developed in King Faisal. And if you look at it closely, the orange one is the UBC, Unit-Based Council, and this is the core of the shared governance model. To your left is the part of the shared governance still, and it shows you that 90% of the changes are coming from the UBC, from the unit level, and 10% happens as shared decisions. So how did it work in CSICU? Well, coming from a 23-bed unit where everybody is busy and they're always doing something, whether day shift or night shift, we open chest every now and then, coming to meetings is really hard for them. It's time-consuming, and sometimes it's difficult to bring the nurses to attend the meetings. We have to take into consideration that this is a journey. Everybody has everybody to contribute in this meetings and endless meetings. But we have to make sure that the staff are able to understand terms like shared governance, empowerment, autonomy, responsibility, and accountability. These are the terms that we have been teaching the staff so that they will be able to understand what we are going through. The process of shared governance is based on the principles of partnership, accountability, equity, and ownership. Now we have the unit-based council. In the unit-based council, we have to make sure that the staff are really interested to come and join. We need their dedication and commitment for it to work. Creating the UBC entails the staff to commit and dedicate their extra time positions to being a chair, a co-chair, secretary, professional development council, and other councils that we will need to the staff to be able to handle, plus working in the unit. We have a monthly combined management and UBC staff meetings, and the first 20 minutes are dedicated to the head nurse chairing the meeting, and the rest of the time is coming from the UBC. Reports and status of the unit is given to the staff by management. The UBC, on the other hand, updates the staff on the issues, challenges, and status of the indicators to discuss the solutions. We also have what we call the ideas for improvement, and this is where the staff talk about what they are going to do. The solutions are coming from the staff and not coming from the management. So how do we know that we are providing the best care to our patients? And we just don't measure it from the patient outcomes. We also have taken into consideration the nurse satisfaction. Because for Magnet to work, for excellence to work, we need to have two things: excellent nurses to deliver excellent patient outcomes. So how are we going to improve if we don't know what is the problem? So thank God for NDNQI. NDNQI is the answer to some of our problems. NDNQI stands for the National Nursing Database of Quality Indicators. This is the only international nursing database that provides quarterly and annual reporting of structures, processes, and outcomes indicators to evaluate nursing care at the unit level. It provides hospitals with unit-level performance, reports with comparison to national averages, percentile rankings, and other important data. It's what we call benchmarking. Nurses are not just about the degree or the training or experience. We also have to check if the nurses at the bedside are happy and what can be done to make sure that they stay in the organization. This is the RN survey from 2011 until 2013, when we were still in the process of magnet. We were getting compared at that time to the non-magnet hospitals. In 2011, 75% participation rate, and we have achieved 0 out of the measures. In 2012, at 100%, the participation rate achieved was 3 out of 10. And in 2013, 81% participation rate, and we were able to manage 7 out of 10 in the indicators. We were not, unfortunately, we're not able to complete the 2014 RN survey. But for some reason, in 2015, when we were already benchmarked with the magnet hospitals, we have achieved 4 out of the 11 indicators. What happened? Well, not rationalizing, but personally speaking, I think that we have a lot of factors that can be taken into consideration. Anyways, yes, we still have a lot of room to improve. So we continue to work with the UBC to come up with better solutions, and hopefully in the next survey in October 2016, at the end of this year, we will be able to improve. Working together and coming up with solutions as a team really will make a big difference. Next, we look into the patient indicators. There are 10 indicators coming from the NDMQI.